Hi guys. So in today's video, we'll be talking about jaundice in newborn. I know jaundice occur in adults, but that will be for other videos. Today, I'm going to focus on jaundice in newborn. Jaundice is caused by hyperbilirubinemia. Wait, it's not a big grammar. Let me explain. So hyper means high. Bilirubin is a substance that is released when old red blood cells break down in our body. And anemia means in the blood. So it means high bilirubin in the blood, which leads to yellowing of the eye and skin, and also dark urine. So there's two type of jaundice, which is pathological jaundice and physiological jaundice. So this is how you will remember. From the pathological jaundice, remember pathogen, meaning it is a type of jaundice that is harmful. From physiological jaundice, remember physically fit. Just remember that the baby is physically fit. That is normal jaundice that is not harmful. Both jaundice actually starts 24 hours after birth. But for the pathological jaundice, it's going to start 24 hours after birth and then gradually increase, like it's going to continue to increase. For the physiological jaundice, it's going to also start 24 hours after birth, but it's going to be peak. That is, it's going to be very high at the third day and the fifth day. And then after that, it's going to decrease. How do we check whether it is high, whether it is increasing or decreasing? There's a test for it. They can do liver function test. Bilirubin will be there, direct bilirubin and indirect bilirubin. But they can also do a singly test, just bilirubin test. Yeah. So we've talked about pathological jaundice and physiological jaundice. Jaundice can occur for this following reason I'm about to say. Increase in production of bilirubin. Increase in reabsorption of bilirubin from the gut. That is, the baby body absorb more than the body needs. And then the most important one is decrease in clearance of bilirubin, even if the body absorb more. But if the body can clear it, it will not cause buildup and then it will not lead to jaundice. But if the body cannot clear it, the bilirubin will pile up and then leads to jaundice. Normally, the liver clears bilirubin. It helps process it and then clear it through urine and stool. But if the body cannot do it, bilirubin will pile up and it will lead to jaundice. What are the possible causes of jaundice? Premature birth, yes. Infection, if the mother has infection, it can lead to jaundice. Excess breakdown of red blood cells, as seen in SS or the sickle cell babies, they can have jaundice. Babies that have liver problem can also have jaundice. And and some other reasons. What are the symptoms of jaundice? Like I said earlier, yellowing of the skin, yellowing of the eyes, dark urine, and weakness. The baby will become very weak. At some point, the baby can refuse breastfeeding. Yes, and the baby will sleep a lot. Like we know, baby sleeps, they sleep, but this one, the baby will sleep a lot. What are the treatments for jaundice? So before I go on the treatment of jaundice, there is one important cause that I forgot to say, and it is one of the important and most common cause for of jaundice in newborn: blood group incompatibility. I'm going to do a complete video on blood group incompatibility, but before then, let me explain briefly. Blood group incompatibility. Okay, so when we do genotype and blood group, for the blood group, we notice plus or minus sign in our blood group, right? That plus or minus sign is resource factor. Most people are positive, but there are some small amount of people that are negative. So if the mother, let's for instance, if the mother is B negative and the father is B positive, the baby will likely be B positive. If the baby is B positive and then the mother is B negative, the mother does not have resource factor, and then the mother is carrying a baby that has resource factor. That positive means the baby has resource factor. The mother's body will be seeing the baby as an intruder, as a foreign object or foreign whatever. Like, who are you? What are you doing here? So I'm going to explain later. So it can also cause jaundice in baby, blood group incompatibility. So let's move on to treatment of jaundice. Phototherapy. For phototherapy, that's where sun comes in. See, there is a misconception about using sun to clear jaundice. You don't necessarily need to put your baby inside the sun. No. We just need, the baby need indirect sunlight. You can just put the baby through the window for some times and then it will clear off. Another treatment is good feeding. Breastfeed your baby. It can clear jaundice. Good breastfeeding. In a severe case, we can use exchange transfusion. Yeah. The baby blood will be exchanged. They will transfuse the baby just to reduce bilirubin in the blood. When should mothers, when should you seek immediate medical attention? When the jaundice occur within 24 hours. Don't say, I want to be sure whether it's the harmful one. Take your baby to the doctor. When your baby cannot take breast milk, when they refuse to take breast milk, take your baby to the doctor. Weakness, when the baby sleep a lot, when the baby sleep a lot, when the yellowing of the eye and the skin become darker every day, take your baby to the doctor. So if you have any question, you can ask me in the comment section. This will be all today. Bye.